Understanding the window of fertility, the time during which a woman can conceive, requires a closer look at the days following ovulation. Ovulation is the process by which a mature egg is released from one of the ovaries, and it marks the most fertile phase of a woman's menstrual cycle. But how long does this window last? How many days after ovulation can you actually get pregnant? To answer these questions, we need to explore the biology of ovulation, the lifespan of both egg and sperm, and the factors that can influence a woman's ability to conceive. Every month, roughly in the middle of the menstrual cycle, a surge in luteinizing hormone triggers the release of a mature egg. This event is ovulation. The released egg begins its journey down the fallopian tube, where it may meet sperm and become fertilized. The timing of this event is critical because both the egg and sperm have limited lifespans once released into the reproductive tract. After ovulation, the egg remains viable, capable of being fertilized, for a relatively short period of time. Most experts agree that the egg can be fertilized for about 12 to 24 hours after it leaves the ovary. This is a remarkably brief window. If sperm are already present in the fallopian tubes when the egg is released, fertilization can happen almost immediately. If not, the egg's chances of being fertilized decline rapidly as time passes. So, how many days after ovulation is it actually possible to get pregnant? The answer, biologically speaking, is that a woman can get pregnant for up to about 24 hours after ovulation. That is, you are most likely to conceive on the day of ovulation and perhaps the day after. After this window, the egg disintegrates and is absorbed by the body, making fertilization impossible until the next cycle. However, it's important to consider the role of sperm. Sperm are much hardier than the egg and can survive in the female reproductive tract for up to 5 days under optimal conditions. This means that intercourse occurring up to 5 days before ovulation can result in pregnancy, as the sperm may still be alive and waiting when the egg is released. But once ovulation has occurred and more than 24 hours have passed, the opportunity for fertilization effectively closes until the next cycle. To summarize, you can get pregnant within about 1 day after ovulation, but the greatest chance of conception occurs if sperm are already present when the egg is released. This is why the days leading up to and including ovulation are considered the most fertile. But the story doesn't end there. Real-life fertility is influenced by more than just the biology of egg and sperm lifespan. Many women wonder how to pinpoint their exact ovulation day and why conception sometimes occurs, even when tracking seems precise. Ovulation doesn't always happen like clockwork. For some women, the timing can vary from cycle to cycle, due to stress, illness, travel, or other factors. Predicting ovulation can be a challenge, especially if cycles are irregular. Methods for tracking ovulation include monitoring basal body temperature, observing changes in cervical mucus, using ovulation predictor kits, or tracking hormonal changes with specialized monitors. Some women experience physical symptoms like mild pain or increased libido around ovulation. Despite all these methods, it's still possible to miss the exact window. Because of the variability in ovulation timing, most fertility experts recommend having intercourse during the fertile window, the 5 days before ovulation and the day of ovulation itself. This approach maximizes the chance that sperm will be present when the egg is released. After ovulation, the chances of pregnancy drop sharply, and by 24 hours post-ovulation, conception is highly unlikely. What about stories of women getting pregnant days after ovulation? In almost all cases, these are explained by miscalculations of the ovulation date. Because many women rely on calendar tracking or symptoms that can be misleading, it's easy to think ovulation occurred on one day, when in fact it happened earlier or later. Sperm can survive for several days, so intercourse that occurred before ovulation may still result in pregnancy even if it seems to have happened after the fact. Another factor to consider is the role of assisted reproductive technologies. In procedures like in vitro fertilization, IVF, eggs can be fertilized outside the body and then implanted at a later date. However, in natural conception, the time frame remains the same. Fertilization must occur within 12 to 24 hours after the egg is released. For couples trying to conceive, understanding the limits of the fertile window can be both reassuring and motivating. It's common to assume that pregnancy can happen at any time during the cycle, but in reality, there's a very brief period when conception is possible. This is why timing intercourse is so important for those hoping to become pregnant, and why consistent contraceptive use is essential for those who wish to avoid pregnancy. For those trying to conceive, here are a few practical tips. 1. Track your cycle. Use a calendar, an app, or ovulation predictor kits to identify your most fertile days. 2. Pay attention to your body. Changes in cervical mucus, slight rises in basal body temperature, or mild pelvic discomfort may signal ovulation. 3. Have regular intercourse. Aim for every other day during the fertile window to maximize your chances. 4. Don't stress about timing. While it's helpful to know your fertile days, ovulation can sometimes surprise you. Regular intercourse throughout your cycle can help. 5. Consult a healthcare provider. If you've been trying to conceive for a year without success, or 6 months if over age 35, consider speaking with a fertility specialist. For those wishing to avoid pregnancy, this information is just as vital. Many natural family planning methods rely on tracking ovulation and avoiding intercourse during the fertile window. However, because sperm can survive for several days and ovulation timing can be unpredictable, these methods require careful attention and are less reliable than other forms of contraception. In summary, the answer to the question, how many days after ovulation can you get pregnant, is that the window is very narrow, up to 24 hours after ovulation. The day of ovulation is the last day you can conceive until your next cycle. However, because sperm can survive in the body for several days, the days leading up to ovulation are also fertile. This means that, with perfect timing, conception can occur from intercourse that took place up to 5 days before ovulation, but not more than a day after. Understanding this brief window can help empower women and couples to make informed choices about their reproductive health. Whether you're trying to conceive or hoping to avoid pregnancy, knowing how your body works is the key to success. It's also important to remember that every individual is different. While the general rules about egg and sperm lifespan apply to most women, variations can occur. Health conditions, medications, and age can all influence fertility. If you have concerns about your cycle or fertility, don't hesitate to reach out to a healthcare provider for personalized advice. In conclusion, the time after ovulation during which a woman can become pregnant is fleeting, just about 1 day. Make the most of this information by tracking your cycle, being aware of your body's signals, and seeking guidance when needed. Understanding your fertile window is a powerful step toward achieving your reproductive goals, whatever they may be.